A new report released by the Montreal Economic Institute sheds light on just how long Canadians are spending in the ER, and the picture isn't pretty. According to the report, the median emergency room visit in Ontario in 2024 lasted exactly 4 hours. While Ontario sits in the middle of the national pack, the situation is hardly comforting. Some hospitals, such as Sunnybrook Health Science Centre in Toronto, reported average stays of over 8 hours. And across the country, the trend points toward worsening delays in timely access to care. To help us unpack the findings and what they mean for healthcare policy and patient outcomes, I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group. To start, we discussed how in Ontario, the average wait time for an ER visit is 4 hours and how that compares to the rest of the country.
Let's address the big elephant in the room, which is basically having to wait as long as 4 hours for emergency care. Seems quite oxymoronic, and we really need to do better in order to bring that down. In Ontario, we're dealing with 4 hours, and that's the median length of stay that we have there. But in other provinces, we're not seeing too much of a difference. In Alberta, for instance, we see about 3 hours and 48 minutes. In British Columbia, a little bit longer at 4 hours, 13 minutes. And on the other end, Quebec shows quite longer wait times, almost 5 hours and 23 minutes. But Newfoundland and Labrador has considerably shorter times at 2 hours and 45 minutes. And so certainly there's a lot of underscoring of what Ontario's performance is when it comes to these other provinces. And it is certainly also reflects on international standards as well, where our wait times are longer than countries like Germany, Australia, and the United Kingdom, where urgent care centers are better prioritized and they have stronger primary care access.
We also discussed if these wait times make the job of a healthcare provider more difficult because patients begin to grow impatient or their symptoms may worsen.
Yes, absolutely. So I think the big concern with us as healthcare providers is there is a certain number of patients that actually leave and will not be seen at all because they find that it's too long a wait. So there's a lot of patient frustration that we have to manage. But of course, the big concern with that is a worsening medical condition. So if they leave the ER and they have something very serious, that mild infection or moderate infection can proceed to something far more dangerous, like sepsis. And because of that, patients can suffer quite severely, have permanent damage because of delayed interventions. For us as providers as well, there is an increased workload and burnout because we do end up seeing higher patient volumes. Patients that should have been triaged at the ER and have left will often come to primary care or urgent centers where we do our best to manage it and certainly help the patients in those situations.
And as I mentioned, Sunnybrook in Toronto and Ottawa's General Campus have the longest wait times in Ontario. Dr. Raut unpacked why wait times are worse at these locations and the factors that play into delayed care.
Right. So Sunnybrook has the longest waiting time in Ontario. We're seeing a median length of about 9 hours and 13 minutes. And if we look at Ottawa's General Hospital, General Campus, that was number two at 7 hours, 34 minutes. So these wait times at Sunnybrook and Ottawa are usually due to a combination of issues. Firstly, locally, they are tertiary care and trauma centers, which means they're the destination for most of the most critical cases in the region. At Sunnybrook, for instance, we'll see the emergency department managing complex trauma cases and very specialized surgeries as well. So certainly there is a local part at play here, but on a systemic level, we do have challenges in our healthcare system that certainly exacerbate this. We see quite severe shorting staffages that are present. Right. We see quite severe staffing shortages that are present and limited bed availability that's playing a huge role. And now we have an increasing aging population as well. So all of these are playing a role here, both on a local level and on a systemic level, which really causes these delays in tertiary centers.
Dr. Raut then compared the pros and cons of Canada's healthcare system to other countries and shared his opinion on what needs to be changed in the healthcare system to shorten ER wait times.
Well, compared to other countries, our healthcare system has some strengths. Certainly, what we do is prioritize universal access. That means every Canadian, regardless of income or background, can receive that essential care. But that equity also comes with longer wait times that we do see as well. I think with Canada's wait times, we can look to other countries for guidance. For example, we see in France, they have these immediate medical care centers that will quickly address these non-life-threatening emergencies and will streamline the emergency care process as well. So I think what we can do is take what we do well and then take to other countries like France and see if we can get the best of both worlds to really get world-class health services in our country. The stemming of our systemic issues comes from staffing shortages, limited bed availability, and an aging population. But we can definitely combat those things. The biggest way we can combat is primary care access and resource allocation. So really removing that bottleneck effect that we have in high demand urban centers, and a strong prioritization of mental health services would be essential. We don't have that much mental health support, and certainly it is playing a larger and larger role in the emergency room as well.